Now let's focus on more vascular birthmarks. This is nevus simplex, otherwise known as a salmon patch, but we also refer to these as either a stork bite when on the back of the scalp or an angel's kiss when on the glabella. My son has one of these. About 30 to 40% of newborns will have one of these, and again, they're more common either on the face or the occipital scalp. Although these were originally considered to be a malformation of blood vessels, we don't really know why they happen, and actually they're more so thought to be due to persistent fetal circulation. These are mildly pink or light red patches that darken either when the baby cries or with physical exertion. Now, 95% of the lesions on the face will resolve by age 2, but the lesions on the occipital scalp tend to be persistent through adulthood, and I see them all the time in adults. Now let's talk about infantile hemangiomas, which are the most common benign tumors of infancy. Now there's a lot to these, but essentially these are vascular tumors that occur in up to 10% of newborns. These typically start with a precursor lesion, which can look like either a bluish gray patch or a small red stain. And between the ages of 3 weeks to 6 to 7 months, these go through a proliferation phase where they become a lot more red, they become larger and more firm. Between 7 to 12 months of age, they sort of plateau and they don't really change, but then they start to involute and regress, and they typically resolve completely between 5 to 10 years of age. Although these are benign, they can have potential complications depending on their size and location, as they can easily ulcerate, which can lead to functional complications, as well as scarring and permanent disfigurement in more severe cases. Topical timolol or pulsed dye laser may be used for small isolated lesions, but in more complicated cases, oral propranolol or intralesional steroids may be used depending on the severity.